Today I am going to explain you about the head injuries that happens at home or around you. The first and foremost thing that frightens you in case of head injury is the bleeding. The scalp tends to bleed heavily when compared to other parts of the body. Just apply firm digital pressure over the edges of the wound to stop the bleeding. The pressure should be applied for more than 5 to 7 minutes. If you still seeing the bleeding, take a clean cloth to apply pressure like a tourniquet over the scalp. In case if it is still bleeding, you have to rush to the hospital for any surgical help to repair the scalp wound by suturing. Along with the bleeding, sometimes you will encounter swelling of the scalp. This means the bleeding is happening inside the scalp. To prevent the swelling to increase, you have to apply ice and pressure over the scalp wound to prevent the size of the swelling to increase. Don't do any rubbing over the scalp wound. It will increase the bleeding and the pain. Along with this bleeding and swelling, if you find a patient with persistent vomitings, altered sensorium, or any seizure kind of activity, you have to take him to the nearest hospital, where neurosurgeon will examine the patient and order the necessary investigations like CT scan to find out the condition of the brain. And the treatment depends upon the results of the CT scan. Thank you.